Water. It's everyone's issue. 70% of our Earth is made up of water. Of that 70%, only 1% is drinkable. Protecting that 1% of drinkable water should be important to all of us. Poor quality drinking water and sanitation are the leading causes for these people getting sick. There are 31 known waterborne illnesses, and diarrhea is a leading cause of death among these diseases. It kills the equivalent of 42 busloads of people every day. More people have access to a cell phone than a toilet. 1 out of every 5 children in a developing country do not live to see their 5th birthday. Just imagine 105 busloads of children dying each day.
Guinea worm disease is a waterborne illness caused by ingesting larvae-carrying fleas that dwell in stagnant water sources. These worms live inside the interperitoneal area between organs of their host for upwards to a year before showing any symptoms. A fully grown female worm can grow to be between 70 centimeters and 120 centimeters in length. At the end stage of the disease, the female will burrow through the skin to release its eggs back into the environment, completing the cycle of infection. The disease has a very low mortality rate. However, with no known vaccine or treatment, the extraction process can take several days to fully remove the adult worms safely, during which risks of secondary infections and long-term disabilities are extremely high. One of the oldest recorded diseases, dating as far back as ancient Persia, the guinea worm has been a plague on many civilizations for hundreds of years. With combined efforts by the World Health Organization, the Carter Center, and the Center of Disease Control has seen the reported incidences of guinea worm drop from millions annually to just under 150 cases in 2013. With continuing efforts, education programs, and better access to safe drinking water, the guinea worm is said to be the first fully eradicated human disease since smallpox.
Leptospirosis is a disease caused by the bacteria Leptospira. The disease is spread through contact with water, soil, or food contaminated by urine from infected animals. Humans can become infected through direct contact with urine or other body fluids from infected animals, as well as contact with water, soil, or food contaminated with the urine of infected animals. The bacteria can enter the body through skin or mucous membranes, especially if the skin is broken from a cut or scratch. Drinking contaminated water can also cause infection. Outbreaks of leptospirosis are usually caused by exposure to contaminated water, such as floodwaters. People that have a higher risk of contracting leptospirosis are those that work with animals, such as farmers, slaughterhouse workers, veterinarians, military personnel, zoo workers, and sewage workers. Also, people who participate in outdoor activities, especially when traveling, such as rafting, canoeing, swimming, camping, and sailing. Leptospirosis is most common in India, China, Southeast Asia, Africa, Australia, Central and South America, and the Caribbean. In humans, leptospirosis can cause a wide range of symptoms, including red eyes, severe body aches and pains, frontal headaches, high fever, rash, vomiting, diarrhea, chills, and jaundice of the skin and eyes.
Campylobacter is a type of spiral-shaped bacteria that can cause an infection in the intestinal tract. It is the most common bacterial cause of intestinal illness in the world. It can be transmitted through animals and humans. Symptoms include nausea, vomiting, bloody diarrhea, abdominal pain, and fever. These symptoms can last about 3 to 5 days. Some ways that you can contract the bacteria are eating undercooked meats, washing foods with contaminated water, recreational water activities, and drinking unpasteurized milk. Some ways the bacteria can get into our water: washing foods that are contaminated with the bacteria, animal feces such as birds or cows that are used as fertilizer or run off into water sources, poor sanitation in developing countries. Annually, 1.3 million people contract a Campylobacter infection. Of that number, approximately 76 people will die. The elderly, the very young, and the immunocompromised are at a higher risk to contract the infection. Preventing the illness can be done by using proper food handling techniques, killing the bacteria with high heat, such as cooking your meats to the proper temperatures, avoiding cross-contamination of all foods, avoid drinking unpasteurized milk, or drinking water from an untreated water source such as a stream, river, lake, or pond. Most importantly, always practice proper hand hygiene.
Hepatitis is the inflammation of the liver. Hepatitis A is the spread through fecal-oral route. The hepatitis A virus mostly revolves around food and drinking water. Other ways to come in contact with the hepatitis A virus is by using cups, bowls, and cutlery that could have been contaminated with feces. The virus can last up to a few weeks to several months. Hepatitis A symptoms include jaundice, a swollen liver, loss of appetite, change in urine or stool color, stomach and joint pain, fever, nausea, vomiting, and fatigue. There is no known treatment for the hepatitis A virus. Hepatitis A is most common among preschool and school-aged children, considering it is most easily spread among children. The hepatitis A virus can be prevented by practicing good personal hygiene. The hepatitis A virus is most common in areas with poor sanitation and lack of safe food and water. High-risk countries of the hepatitis A virus include Africa, Asia, Central, and South America. Hepatitis A has killed approximately 1.4 million individuals worldwide each year.
Escherichia coli is a bacteria that lives inside human and animal intestines that can be transmitted through water and food. It is transmitted through food and water. The bacteria needs to enter through the mouth, so if you touch something contaminated and touch your mouth, you can become infected. It is transmitted if food is not cooked to a high enough temperature and through raw fruits and vegetables that have been in contaminated ground or water. Symptoms include bloody diarrhea, severe abdominal cramps, non-bloody diarrhea, mild fever or no fever, vomiting, and hemolytic uremic syndrome. Hemolytic uremic syndrome affects children up to the age of 10 and the elderly. This is when kidney failure occurs because the red blood cells die. It is treated by blood transfusions and dialysis. 3 to 5% will die and 15% will develop hemolytic uremic syndrome. Diarrhea is the second biggest killer of children in developing countries. Escherichia coli and other diseases account for 1.5 million deaths a year. Diagnosis is done through stool testing, and there is no treatment. What is needed is lots of clean, fresh water and liquids.
Cyclosporiasis is an intestinal parasite that is found in fecal matter. Cyclosporiasis only becomes infectious when the parasite is excreted from the body and is transferred onto produce or into water. Cyclosporiasis is endemic, in which it is commonly found among a grouping of people residing in one particular area. Most common reports of cyclosporiasis come from subtropical regions of the world. Cyclosporiasis is brought into Canada through fresh produce and contaminated water. Although cyclosporiasis is rarely fatal, it can result in death if the symptoms are not properly treated. Symptoms of cyclosporiasis can include diarrhea, abdominal cramping, nausea, fatigue, and gas. Less common symptoms include vomiting and low-grade fever. These symptoms can last from a few days up to a month, and in some cases longer. Cyclosporiasis is most commonly treated through antibiotic medication prescribed by a doctor. In order to prevent getting cyclosporiasis, it is important to thoroughly wash fresh produce and maintain proper hygiene at all times. If traveling, pay close attention to the cleanliness of your food and how it has been handled through the cooking process. Also, pay attention to where the water you are drinking is coming from.
Ambiasis is a parasite located in the large intestines from contaminated water and food. A human eats contaminated water and food. The bacteria reproduces in the intestines. The bacteria breaks the intestine wall and goes into the blood. After it travels to the liver, where it causes abscesses, finally it comes out in your stool and so can be passed on to another person. This map shows where ambiasis is most common to get the parasite. Each year, 50 million people contract ambiasis through contaminated water and food, and 70,000 deaths occur each year. An easy way to prevent ambiasis is always boil the water before drinking if you're traveling in these locations.
Typhoid fever is a bacterial infection caused by a bacteria known as Salmonella typhi. Symptoms of typhoid fever include fever, headache, and severe abdominal pain. Typhoid fever is most common in countries such as Africa, Central America, India, the Middle East, South America, as well as South and Southeast Asia. In these underdeveloped countries, typhoid fever makes its way into water through poor sewage disposal and no access to sources of clean drinking water. In humans, typhoid fever is generally contracted through the fecal-oral route, meaning food or water that is contaminated with feces is consumed. Although anyone is susceptible to the disease, children aged 5 to 19 are most at risk. Seeking medical attention for symptoms of typhoid fever can lead to early diagnosis. Early diagnosis can lead to an effective course of treatment for the disease, which may include antibiotics. Providing sources of clean water as well as vaccines to those most at risk of contracting the disease would greatly reduce the spread of typhoid fever.
Cholera. Cholera is a terrible water disease that once you are infected can cause severe diarrhea, vomiting, loss of bodily fluids, which can lead to dehydration and without treatment can also lead to death. Cholera is a type of infection of the intestines. People get it from drinking water or eating food that has been contaminated with a type of bacteria called Vibrio chlori. Cholera can be treated by giving a patient a blend of water, salt, and sugar in large amounts. This will help stop the diarrhea and help replenish fluids in the body. There is also medication to help stop cholera, but it is still recommended to rehydrate the body. Cholera is alive and well in different countries such as Africa, Afghanistan, Haiti, India, Pakistan, Mexico, and other countries that have underdeveloped water treatments. There is a vaccine for cholera, but it only lasts for roughly 2 months and it does not protect against cholera 100%. Individuals living in places with inadequate water treatments, sanitation, and hygiene are at greater risk for cholera.
Rotavirus is a virus that causes your stomach as well as intestines to inflame and is frequently the cause of severe diarrhea in children. While anyone can contract rotavirus, infants and children are more prone to get it, and most have already had it by the time they reach age 5. The virus is found in the fecal matter of someone who is infected and is transmitted by coming into contact with contaminated objects and touching your face and mouth. The virus can be spread through contaminated wells, sewage overflows, polluted runoffs, malfunctioning sewage systems, flooding, and is extremely contagious, so it is important to take proper safety precautions by washing your hands and body thoroughly. Symptoms of rotavirus include fever, vomiting, severe diarrhea, abdominal pain, inflamed stomach and intestines, dehydration, and loss of appetite. Each year, rotavirus infections are responsible for about 3 million cases of diarrhea and 55,000 hospitalizations for diarrhea and dehydration in children younger than 5 years of age. There is no treatment for rotavirus once you've been infected, and the effects can last anywhere between 3 to 8 days. It is imperative that plenty of liquids are consumed by those infected, as dehydration is extremely dangerous for children. There is, however, 2 vaccines that can be given for the prevention of a rotavirus, and they are both taken orally. Also be sure to maintain good hygiene to stop the spread of a rotavirus.
Salmonella is the bacteria responsible for the majority of food and waterborne illnesses around the world. This bacteria affects mainly the intestinal tract. Salmonella is from the feces of reptiles, birds, animals, and humans. The bacteria is released into the world when these infected animals or humans have a bowel movement. Millions of germs can be released in a single bowel movement. This waste can then leak into drinking water from backed up sewage systems, poorly installed sewage systems, and a big cause is agricultural runoff. Symptoms of Salmonella infection usually start 12 to 72 hours after ingesting the bacteria. Symptoms include diarrhea, fever, cramps, vomiting, headache, nausea, and muscle pain. Many Salmonella infections run their course on their own 5 to 7 days without any treatment. The most important thing is to stay hydrated during this time because of the vomiting and diarrhea the bacteria causes. When experiencing extreme symptoms lasting longer than 5 to 7 days, an antibiotic can be prescribed. In serious cases, it can take months to years for the gut to return back to normal function. And if symptoms worsen and go untreated, Salmonella can be fatal. Salmonella is found worldwide. The bacteria is an issue in both developing and undeveloped countries. Worldwide, it is estimated that there is 1.3 billion cases of Salmonella every year, and many cases go untreated and unrecorded. Salmonella is responsible for approximately 155,000 deaths a year. Infants, young children, elderly, and persons with a weakened immune system are the most susceptible to Salmonella.